Welcome to the Deep Dive. Today we're tackling something I think many of you as listening might know all too well. That relentless, maddening itch that affects our pets.
Pruritus. It's that intense feeling that just makes them scratch and lick and chew, sometimes nonstop.
Yeah, it drives everyone crazy, the pets and their humans. And looking at the sources we've gathered for this deep dive, it's clearly much more complex than just, my dog scratching.
Oh, absolutely. It's rarely that simple.
So our mission today is to really unpack these sources. We want to get past the surface level and understand what pruritus actually is, the science behind it, why it happens, how vets figure it out, and crucially, what the effective treatment strategies look like.
Because the core message, really, coming through in this material is that managing this long-term is all about finding the underlying cause. You can't just keep chasing the itch itself forever.
Right. Okay, let's dive in. First things first. What exactly is pruritus? The sources have a specific definition, don't they?
They do. It's not the scratching itself, but the sensation, the feeling that triggers the need to scratch or lick or bite.
Okay, so it's the internal signal, not the external action. And I see mentions of acute versus chronic.
Yeah, acute itch can be, a normal protective thing, part of the immune system saying, hey, something's here. But what we're mostly focused on and what these sources emphasize is chronic pruritus, the persistent kind.
The kind that becomes a real problem.
Exactly. And right up front, the sources state this fundamental point. Long-term control means you have to identify and treat the underlying cause. That's how you reduce the reliance on constant medication.
Makes sense. Treat the source, not just the symptom.
Precisely. And they also recommend that, ideally, chronic or complex cases, they should really be seen by a veterinary dermatologist.
Specialist, help for a specialist problem. And it affects the skin, primarily, but also behavior.
Right. The skin exocrine system is obviously involved, but all that scratching and licking we see, that's a huge behavioral component too.
Okay, so let's get into the science a bit. What's actually happening, at the cellular level, to cause that itchy sensation?
So the sources describe this process, the pathophysiology. It involves nerve cells in the skin getting activated.
Okay.
And they get triggered by chemicals. These chemicals are released by other cells nearby skin cells themselves, like keratinocytes and various immune cells, mast cells, eosinophils, lymphocytes, those sorts of cells.
So these cells are sending out itch signals, like little chemical messengers.
Basically, yes. Things called cytokines, neurotrophins, neuropeptides. And it's complex. The sources note that lots of factors can tweak how intense that signal feels, both locally in the skin and centrally in the brain.
Which explains why some pets seem itchier than others, even with maybe the same underlying issue.
It could definitely play a role, yeah. So that's the hidden process. What about what we actually see, the signs?
Right. What are the outward clues for owners or vets?
Well, the obvious ones are the behaviors, the scratching, licking, biting, rubbing against furniture, chewing.
The classic signs, my dog won't stop licking his paws, or the cat's constantly digging at her ears.
Exactly those things. And often this leads to self-trauma, which then causes visible skin changes, redness, thickening, maybe scabs, or infection.
Makes sense.
Now, there's an interesting point the sources make specifically about cats. Sometimes the main thing you see is just hair loss alopecia.
Without obvious sores or redness.
Right. They can be such efficient groomers, licking the hair away without causing dramatic inflammation, at least initially. That's a bit different from dogs, where you usually see the inflammation more clearly alongside the scratching.
That's a really key difference to keep in mind for cat owners. Okay, we know what it is, the mechanism, the signs. Now, the million-dollar question, why? Why are they so itchy? And the sources stress it's usually not just one thing.
That's a critical point. It's often multifactorial, meaning you might have more than one disease process contributing to the itch simultaneously.
So you might need to tackle multiple problems.
Very often, yes. The sources break down the main categories of causes. First up, parasites.
The creepy crawlies, fleas, I assume.
Fleas are a big one, definitely. But the list is pretty extensive. Mites like Sarcoptes, that's scabies demodex, ear mites, Otodex, Notoadres in cats, Shaleatiella or walking dandruff, chiggers, Trumbicula, lice, even some rarer ones like Pelodera or migrating internal parasites.
Wow, quite the rogues gallery.
And a really important note here, especially about scabies in dogs, it's notoriously hard to diagnose definitively. Skin scrapes, often negative, even if the dog has it.
So you can't rule it out just because a test is negative. That might explain why sometimes vets do a treatment trial for scabies.
Exactly. It can be a diagnostic step in itself because it's so sneaky. Okay, next big category, Allergies.
This feels like a huge one.
It absolutely is. Allergies are a major, major cause of chronic itch. This includes flea allergy, dermatitis, an allergy to flea saliva, and then there's atopy.
That's environmental allergies, right? Pollens, dust mites.
Correct. Pollens, dust mites, molds, things like that. Also under allergies, cutaneous adverse reactions to food, contact allergies, drug hypersensitivities, and even hypersensitivity to bacteria or yeast like Malassezia.
So many possibilities. The sources go into a bit more detail on atopy. What are its classic features?
Typically, uncomplicated atopy starts between ages 1 and 3. Initially, it often responds well to steroids.
Right.
It might start seasonally, maybe worse in spring or fall, depending on the allergen, but it often becomes a year-round problem over time. And it causes progressive itchiness, usually affecting specific areas, the face, feet, ears, front legs, armpits, and the rear end area.
A characteristic pattern, then.
Yes. And the sources warn that if atopy isn't managed well, treatments can become less effective over time. That's called tachyphylaxis.
Oh, right. So you need higher doses or different drugs later on. That's not ideal.
Definitely not. And this leads to a really key point about atopy treatment in the sources. Allergen-specific immunotherapy, allergy shots, or drops based on testing is highlighted as the only treatment that can potentially offer long-term control without needing constant medication.
Because it's actually trying to retrain the immune system, not just suppress the itch.
Exactly. It addresses the underlying immune response. And interestingly, they also note that animals with flea allergies or food issues might be more prone to developing atopy later.
That's a crucial takeaway about immunotherapy. Okay, what about infections? Bacteria and yeast seem to come up a lot.
They do. Staph bacteria and Malassezia yeast are very common secondary invaders. Ringworm, or dermatophyte, is mentioned but considered less common as a primary cause of itch compared to the others.
And secondary is the key word there, right?
Absolutely crucial. These infections often pop up because the skin barrier is damaged or the immune system is altered by the primary problem, like an allergy or parasites. So yes, you have to treat the infection.
But it'll just come back.
If you don't fix the underlying reason it happened in the first place, it's like bailing water out of a leaky boat without patching the hole.
Perfect analogy.
Yeah.
You have to fix the leak.
Yeah.
Are there other causes mentioned?
Yes. The sources round out the list with things like primary or secondary seborrhea, that scaly, greasy skin condition calcinosis cutis, which is calcium deposits, skin cancers, immune-mediated skin diseases where the body attacks itself, and also psychogenic causes.
Psychogenic, like stress-related licking.
Yeah, where anxiety or stress leads to excessive grooming, which then causes skin damage and itch.
Wow. Okay. That is a lot of potential causes.
Yeah.
So how do you possibly figure out which one or which ones are actually causing the problem in a specific animal? This sounds like serious detective work.
It really is. And the sources hammer this home.
Yeah.
Identifying the underlying cause or causes is everything. Remember, it could be multiple things.
Right.
The starting point is always, always a thorough history from you, the owner, what you've observed, when it started, any patterns, and a detailed physical exam by the vet.
Gathering the clues. What about specific tests?
Common first steps include skin scrapes, good for Demodex, maybe Sarcoptes, but again, often negative for scabies. Then there's epidermal cytology.
Looking at cells under the microscope.
Exactly. Taking samples from the skin surface to look for bacteria or yeast, those common secondary problems. A fungal culture, or dermatophyte culture, is needed for ringworm. And a skin biopsy might be done if the lesions look unusual or if the vet suspects a primary skin disease rather than just reaction to scratching.
Okay, now, allergy testing gets specific attention in the sources, and it sounds like there's some common misunderstandings.
Yes, this is super important. The sources are very clear. A positive allergy test result, whether skin or blood, does not automatically mean that allergy is the reason the pet is itchy right now.
Okay, wait. Say that again? A positive test doesn't mean it's the cause.
Not on its own. The test shows sensitization, meaning the animal's immune system has produced antibodies against that allergen. But it doesn't confirm that the allergen is actively causing the current clinical signs.
So it's a piece of the puzzle, not the whole picture.
Exactly. The main use of allergy testing, according to these sources, is to select the specific allergens to put into allergen-specific immunotherapy after you've already determined through history, exam, and ruling out other causes that atopy is the likely diagnosis. The test results must be interpreted alongside everything else.
That makes so much more sense. It guides the treatment once you've decided allergy is the problem.
Precisely. And they compare the two main types. skin testing, intradermal, and serum blood testing. Skin testing is called the gold standard. It's seen as more physiologically relevant because you're seeing the reaction in the skin itself.
The little bumps that show up.
Right. Serum tests measure IgE antibodies in the blood. The sources say these are not physiological tests in the same way, and their repeatability and consistency can be highly variable. They're considered acceptable mainly when skin testing isn't feasible.
So skin testing is generally preferred for picking immunotherapy ingredients if possible.
That's the guidance here, yes. Now, another diagnostic tool mentioned is the trial treatment. We touched on this with scabies.
Right, treating for something to see if it helps confirm the diagnosis.
Exactly. Like the empirical scabies treatment, or a really common and important one, the restricted ingredient diet trial for suspected food hypersensitivity.
The food trial. Okay, this also gets a very specific warning in the sources about certain tests, doesn't it?
It does, and this is critical for listeners to hear. A proper food trial means feeding only a special diet for a set period, usually 6 to 8 weeks or more. This diet needs to have either a novel protein the pet has never encountered before, or a hydrolyzed protein, where the proteins are broken down too small for the immune system to recognize.
Okay, strict diet, novel or hydrolyzed protein, got it.
Now here's the warning. The sources explicitly state that while commercial tests for food allergies exist, things like blood tests, saliva tests, even hair tests that you might see advertised.
Yeah, I've seen those online.
Right. The sources say multiple studies have shown these tests have neither demonstrated efficacy nor accuracy. They flat out state these commercial tests are not recommended.
Wow, that's blunt. So those tests are basically unreliable for diagnosing food allergies according to this material.
That's the strong conclusion presented here. The only reliable way to diagnose or rule out food allergy is the strict dietary elimination trial.
Good to know. Okay, so we've gone through the detective work. Let's say we have identified a cause or causes. How do we actually treat the itch?
Again, the primary goal, as stated, is to treat or remove the underlying cause whenever possible. That's the path to long-term control and minimizing medication. And again, chronic cases. Consider that dermatologist referral.
Right, so what are the approaches? Topical treatments seem important.
Yes, topical therapy things applied directly to the skin is useful for most itchy pets. It can be localized, like sprays, lotions, or creams for specific hot spots.
For targeted relief.
Or generalized treatments for wider issues, like medicated shampoos, conditioners, or rinses. Colloidal oatmeal is mentioned as common, giving some temporary relief, but the effect doesn't last very long.
What about topical steroids? Creams or sprays with corticosteroids?
They are highlighted as very useful, especially for reducing the need for systemic drugs. If a localized spot responds well to a topical steroid, that's often preferred. Low-potency ones, like the Genesis spray mentioned, can be helpful for longer-term spot management. But even low-potency ones need care over use, can still cause local side effects like skin thinning.
So helpful, but use wisely. What about systemic therapy pills or injections?
This is where it gets really dependent on the diagnosis. The sources stress that systemic treatment choices depend entirely on the underlying cause you found.
Back to the why.
Always. If it's scabies, you need drugs that kill scabies mites. Food allergy, it's the diet. Apodopy. The ideal long-term plan is allergen immunotherapy, flea allergy. Aggressive flea control is paramount. And those secondary infections.
Treat them, but know they'll come back if the primary issue isn't managed.
You got it. Treat the bacteria or yeast, absolutely, but find and manage the reason they keep showing up.
Okay, the sources detail some specific drug categories used systemically. Glucocorticosteroids, steroids like prednisone are probably the best known.
They are powerful and widely used. They affect lots of different pathways involved in inflammation and itch. They work fast, and the dose is easy to adjust, so they're good for getting quick relief during flare-ups.
Useful for immediate comfort.
Yeah. The sources give some specifics, like an injectable dose of dexamethasone for acute relief that lasts a few days with minimal side effects like excessive thirst or urination. For chronic control, like managing atopy while waiting for immunotherapy to work, they talk about using oral prednisolone or prednisone, starting at a certain dose and tapering down. The goal is often a very low, every other day maintenance dose, maybe around half the body's natural production, which can sometimes be well tolerated.
So they can be used long-term, but very carefully managed at low doses. What about cyclosporine, like Atopica?
Cyclosporine, the modified version, is specifically noted as effective for chronic atopic dermatitis. Its success rate might be similar to steroids eventually, but the big difference is it's slow to start working, maybe takes 1 to 4 weeks for full effect.
So not for immediate relief.
No. But the upside is many patients can eventually be maintained on less frequent dosing, maybe every 2 to 4 days.
Hmm.
It does require monitoring, like blood work, and sometimes checking drug levels, especially in cats.
Okay. A newer drug class mentioned is oclacitinib, a JK inhibitor.
Yes, alclicitinib. It's a different mechanism, targets Janus kinase enzymes involved in the itch and inflammation signaling pathways.
Hmm.
The sources mention the dosing twice daily initially, then down to once daily for maintenance. It's another tool in the toolbox.
Different pathway, different option.
Yeah.
What about antihistamines? People often try Benadryl or similar drugs first.
The sources describe their efficacy as pretty variable in pets. For cats, they estimate maybe only 10–50% effective. They list some common examples and doses for dogs and cats, but the takeaway is they're kind of hit or miss. Not a reliable primary therapy for severe itch, usually.
Okay. And fatty acids, omega-3 supplements.
They're discussed for their role in modulating inflammation and maybe improving the skin barrier. Specific types like EPA and linoleic acid are mentioned. Omega-3s might be more helpful than omega-6s, but the key thing here is they take time, potentially 6 to 8 weeks of consistent use to see the maximum benefit.
Patience required, not a quick fix.
Definitely not. And finally, behavior-modifying drugs are listed.
For the psychogenic cases? Or breaking the itch-scratch cycle?
Likely both. Examples include amitriptyline and doxepin, which also has antihistamine effects, fluoxetine, and gabapentin. Gabapentin is noted particularly as a pain modifier, which might help with the discomfort associated with chronic skin inflammation and itch.
Interesting. Now, there's a really crucial warning here about using these itch relief meds, these palliative therapies, if there's an underlying infection.
Yes, this is vital. The sources strongly advise against just suppressing the itch with drugs like steroids if the root cause is an infection, bacterial, fungal, yeast. You must identify and treat the infection properly first.
Why is that so important?
Because steroids, for example, suppress the immune system. If you give them while there's an active infection, you can make the infection much, much worse and harder to clear. You risk masking the problem while letting it fester. Diagnosis first is key, and referral might be needed if infection is suspected.
Makes total sense. Don't weaken the defenses when there's an invader. Okay, so treatment is underway. What about long-term management and monitoring for these often chronic conditions?
This is where the partnership comes in. The sources stress that ongoing patient monitoring and really good communication with you, the owner, are imperative.
Because it can be frustrating.
Very much so. Client education is huge, helping owners understand the condition, the treatment plan, the potential for flare-ups, why monitoring is needed. It manages expectations and improves compliance.
Got it. It's a team effort.
Absolutely. And remember, it might be multifactorial. You might need to manage more than one issue, like allergy and secondary infections and flea control, to keep the itch below that animal's individual itch threshold.
Sure.
Also, keep seasonality in mind if it applies.
And regular checkups are important if they're on long-term meds.
Essential. For monitoring potential side effects, especially with chronic steroid use, which can have complications. And also, things change. A new problem might develop, or an old one might flare up.
So tests that were negative before might need repeating later.
Exactly. If symptoms come back or change, you might need to reevaluate. The diagnostic process isn't always a one-and-done thing for chronic conditions.
Wow. Okay, this has been a really comprehensive deep dive. We went from defining pruritus as that sensation, looked at the cell signals firing off, explored that huge list of causes, parasites, allergies like atopy, infections, and others.
Navigated the diagnostic maze, the history, exams, scrapes, cytology, the critical nuances of allergy testing, and the only reliable way to check for food issues being the diet trial.
Then explored the treatments. From topicals to systemics like steroids, cyclosporine, colacetinib, and others, always emphasizing treating the cause, not just the symptom.
And landed on the importance of long-term management, monitoring, and that crucial vet-owner partnership.
It really drives home that successful control isn't just about stopping the scratching you see today. It's about figuring out the why and addressing that.
Precisely. Finding and managing the root cause is the only sustainable path.
Thinking about it, really understanding that the scratching is just the outward sign of that internal feeling. It does change how you view a pet who's constantly licking or chewing. It's not just a bad habit.
It really does. It highlights the discomfort they're experiencing. And it makes you appreciate the ongoing research and development of new treatments, like those JK inhibitors mentioned, that offer more targeted ways to interrupt that itch signal, providing relief when we can't completely eliminate the underlying trigger, like in many cases of atopy.
Absolutely. It's a complex, ongoing challenge, but understanding it better, like we've tried to do today based on these sources, is the first step towards better management.